Super important question. So we'll do this quickly. 30-year-old woman, excessive thirst, frequent urination, drinking large amounts of water throughout the day. And she's got a fasting glucose of 88, and there's a water deprivation test. And it looks like whenever we give her vasopressin, the osmolality is increasing. That means ADH is working. We are actually taking out water through those receptors, and that means it's functional. So it's central diabetes insipidus. So let's talk about this for a second. The reason why it's not nephrogenic and not any partial nephrogenic or anything like that is because the receptors are functional. How do we know this? Is because we gave them ADH and boom, it worked. So there is receptivity to the ADH, and after you give them vasopressin or desmopressin or the DDAVP test, then they respond, they do well. And so it's like they're not secreting the ADH in the first place. That's the problem, and that's central diabetes. But if it were nephrogenic, then it'd be caused by abnormal receptors in the collecting duct. And then you can give them all the ADH they want, and it's not going to work. And partial, you'd give them ADH, and it would just like there'd be a partial improvement. And so it's neither of those. Central DI would be head traumas, pituitary problems. That stuff is the cause. But when it's central diabetes, it's going to be that stuff. But whenever it's nephrogenic, it's going to be caused by like lithium toxicity. It's a very common one. So bipolar medication is very frequent there. If it's nephrogenic, hypercalcemia, genetic mutations, it is genetic as well, important to know. Partial, slow, gradual rise in osmolality, but not further increase after ADH. So unlike the complete one, there is some response to ADH, but it's still suboptimal. Okay, so polydipsia, excessive water intake, and suppressing of ADH secretion. So the urine osmolality will gradually increase during water deprivation, and it's associated with psychiatric disorders. Like you got to drink to ward away the evil spirits. Post-obstructive diuresis occurs after relief of urinary obstruction. Urine osmolality remains normal over time and no excessive thirst. And so hopefully this was a good little question here for you. If it was, like and subscribe.